So let's talk about the treatment options you can have for high temperatures for the little ones in a pharmacy. Now, normal temperature is between 36.5 to 38 degrees Celsius, so above 38 degrees we consider you to have a high temperature. Now, between the age of 1 month to 3 months, your only option is Panadol. Again, if it does not bring the temperature down after a dose of this within 1 to 2 hours, you really need to be seeing the doctor. After 3 months, we can start to use Nurofen to help bring down the temperature as well. Now, you can use both of these medications together. There are limitations. Obviously, with Panadol, you can only give 4 doses in a 24-hour period, and with Nurofen, you can only give 3 doses in a 24-hour period. Now, you can dose Panadol every 4 hours, which means you can actually sneak 6 doses in a 24-hour period, and with Nurofen, you can dose every 6 hours, which means you can sneak up to 4 doses in a 24-hour period, but you cannot go to these dose levels because of the problems that they can cause. With Panadol, your liver cannot clear it quick enough and causes toxins to build up, and Nurofen can cause problems with kidneys, etc. So what's the trick? You can use them together with not going past your 4 and your 3 doses in a 24-hour period. Now the problem is that we normally pick one to start with, give that an hour and a half to work. If it hasn't worked, add the second one in. Now, write these down, keep a note somewhere, because we need to make sure we're not going past 4 doses of Panadol in 24 hours or those 3 doses of Nurofen. But they can quite safely be used together to help bring down the temperature. Obviously, if they're not working and the temperature is staying above 40 degrees, you will need to be seeing a doctor. Traditionally, 48 hours for anyone above the age of 12 months can go with using the medication before seeking medical advice. Below 12 months, we should obviously be seeing a doctor if it's more than 24 hours. So do I have a preference between Panadol and Nurofen? Not really, both equally bring down temperatures well. Nurofen is an anti-inflammatory, so if the problem has been caused by an inflammation, such as an earache or teething problems, it may be slightly more advantageous to use this. Again, 10% of asthmatics can't take Nurofen, so be aware of that if there's asthma in the family. Panadol is a little bit gentler on the stomach. Again, the incidence of stomach upset is very low with Nurofen, but again, it can come down to just which flavors or which one the kid will take to help bring down the temperature as quick as possible.